A real pleasure to be here today in front of all of you. I'll be talking a little bit about aligning with strategy and talking to you specifically from a health system perspective in terms of a case study in what I call proactive innovation. You know, we're living in an amazing time right now. I believe vehemently that data is the scaffolding that really ties together the past, our present, and the future we're actively building. So what I'll cover today is where we are, the context, because context matters, where we're going, the dream, social impact, and our bold goal, and how we'll get there, the journey, the community immunity for all program, as well as a number of things that are powered by GIS. So join me on this journey forward. Healthcare up to this moment has really been defined primarily by bricks and mortar. The patient comes to our facilities, is seen, labs might get collected. I'm a radiologist, a radiology exam might be presented, vitals. We examine the patient receives treatment recommendations, gets discharged. But clinical care of this nature is just the tip of the iceberg. There is so much more to it. There can be no doubt that where we live determines the real elements of what matters the most to us as individuals and communities. We're not just a code or a number or a patient that comes in to healthcare facilities to get better from an illness. The notion here is not just to survive, but truly to thrive. So where we live determines the real elements of what really matters to us. The pollutants we get exposed to, the community services available to us, how affordable and accessible healthcare is, and whether we're likely to suffer from preventable disparities as well. Today, I'm going to make the argument that it's time to regularly lift our eyes from the microscope and think more telescopically, taking a broader view and, in fact, a more holistic story of who we really are. The father of medicine himself, Hippocrates, recognized the importance of place on human health outcomes in his writings in Airs, Water, and Places. His point of where people live and the environments around them are just so relevant to what we're doing. Our communities that create those contextual circumstances have a powerful impact on our health. And while our communities cannot curb our carvings, they can craft our choices. So the opportunity statement that I'd like to put in front of all of you is, how do we help make the healthy choice the easy choice? Our environments shape how we see our world. They cannot change our eye color, but they can change our vision and the way we see and behave in our world. When it comes to our health and well-being, it's been said that our zip code is more important than our genetic code. And I vehemently believe that as well. Place or context matters tremendously to everything that we're doing. Have you ever recommended that a patient gets more exercise without knowing that that might just be the only option that they have? Walking, as you can see here, along a major highway, putting them at risk for injury or even asthma exacerbations from automobile exhaust, and living within the limited means that they might have. So context is king. And it's really important to make sure that we're able to bring all of that in the specific decisions that we're making and the behavior change that we're really striving for. So when it comes to our health, it's been shown that when we exclude genetics, 80% of our health outcomes are context driven. It's our physical environment and our socio-economic conditions that really influence our personal behaviors. And really, it is about behavior change. It is about data driving the context of those discussions. And we're living in a contextual crisis of health inequities. Health inequities are created when people cannot attain optimal health because of unjust, unnecessary, and unavoidable circumstances, and are more prevalent among low-income communities and people of color. And I'm seeing that galore in the Southeast where I'm speaking to you from. Inequities impact health outcomes such as mortality, morbidity, and healthcare costs by as much as 80%. In North Carolina, people of color are more likely to die of various diseases or conditions that exist in our state and our areas. At Atrium Health, we're using data, influence, and partnerships to create meaningful change in these specific communities. In fact, we've proclaimed a bold goal for social impact and health equity that by 2030 will improve the life expectancy gap in our most vulnerable communities. And we'll do that through access and quality of care and addressing individual and community elements. So it's really, really important. Context is king. And GIS really sits in the specific elements of how it is that we're driving this forward. So GIS and the science of where is central to our strategies in terms of how we serve our communities, whether it's analyzing the specific gaps in care, whether it's planning our specific strategies, opening up our urgent care centers, opening up our next healthcare system. In fact, we've got some bold announcements yet coming out in the next couple of months in terms of how we're continuing to push the envelope in that realm, whether it's evaluating specific capabilities and strategies and elements that we're pushing forward with, or executing to those specific strategies as well. GIS is critical. So the science of where is central to our strategies in terms of how we serve our communities. And from our experience, I cannot overemphasize the importance of the right technology to account for the complexity of the community context, right? So all of these different parameters that we're looking at, right? It is really the right technology at the right time driving towards the right behavior change. At Atrium Health, we're leveraging GIS data to address social inequities and to power achievement of our 2030 bold goal, right? It's one pathway for this, our community immunity for all work. So using GIS decision tools, we've ranked decision score by community. We're doing a lot of analytics work at the back end to really meet our goal of prioritizing, for example, vaccine distribution in communities with the greatest needs. From a function perspective, what we're doing is we're highlighting areas with the largest vaccination disparities and the greatest social vulnerabilities. So it's really data that's really showcasing to us the specifics of where and how intentionally we need to address these specific disparities. And with this data, we've been able to send out our roving vaccine units to make the greatest impact in those specific populations. And that's just one example of many, many things that we're continuing to push ahead with to address those disparities. A GIS map is used to also geographically visualize decision score rankings, along with individual factors such as population density and median income, and highlight the location of community distribution sites, such as churches and schools. And in fact, just even this morning, I was talking about how we're going after folks that are under bridges, literally, not just in churches and in the schools and in the underserved zip codes that we're targeting. But armed with this data, we can then send out our roving testing and vaccination units to the areas of greatest need and inequity in the communities that we serve. And it's partnerships with county health departments, the North Carolina Department of Health and Human Services, and other health and human services groups to really move quickly to address identified disparities, also to enhance the power of our GIS data and ultimate health impact. I'll give you an additional example here. We've demonstrated really amazing commitment to our communities with our public-private partnerships with the likes of Honeywell, Tepper Sports and Entertainment, and the Charlotte Motor Speedway to promote community immunity for all. The Bank of America Stadium was chosen as one central location for our disadvantaged communities to ensure that we were providing vaccines in an area convenient for all. And leveraging GIS and our advanced analytics capabilities, we're able to target messaging to those specific communities. And at our first mass vaccination event at the Panther Stadium, and we've had several of these already, we provided a shot in the arm every 4 seconds. It's just absolutely magnificent. And through multiple events like this, we're on our way to achieving our goal of 1 million vaccines by Independence Day, July 4th. And that's pretty remarkable. So over a weekend, the likes of 20,000 shots in arms across the board. Just absolutely remarkable. So through these mass vaccination efforts, we're transforming fear into hope. At the first Bank of America Stadium event, 21% of those vaccinated were from our underserved populations. And overall, there was a 127% improvement in the number of Black and African Americans and a 212% improvement in the number of Hispanic and Latinos, representing 12 and 2.5% respectively of vaccinated community members at the Bank of America Stadium, compared to the Charlotte Motor Speedway event just a few weeks earlier. So we're continuing to improve, we're continuing to monitor, and we're leveraging data to really then drive our decisions as well as the specifics of how we impact care. Our teams have been working around the clock, following state guidelines to vaccinate as many frontline workers, community members, and underserved communities as quickly and efficiently as possible. And as more people continue to become eligible to receive the vaccines across our system, we've come up with innovative ways to vaccinate larger groups at one time. So really, really interesting in how we're leveraging GIS as well as data and analytics to drive towards specific impactful initiatives like what I'm talking to you about today. And in addition to the multiple mass vaccination efforts at the Charlotte Motor Speedway and the Bank of America Stadium to reach community members who are 65 years and older, we also partnered with First Baptist Church West and the Jenkins Memorial Presbyterian Church and the Rockwell AME Zion Church to vaccinate nearly 300 community members at our first mobile vaccination community event, going directly into our most vulnerable communities of color to provide life-saving care. And we're doing dozens of these activities across the board on a very, very regular basis. And the impact that we're having across the communities that we're serving is real. It's palpable. We can see that these community members are responding in kind, not just with health, but also with hope and healing, which essentially is our tag phrase here at Atrium Health. This is our mission of health, hope, and healing for all. So the science of where dictates the specifics of how, when, and how much. GIS is not just a tool, it's a strategic mindset on our journey forward. It is integral to all of the strategies that we're pulling together, all of the innovations that we're continuing to push ahead with, but also all of the impact that we're co-creating with our community leaders, with the Health and Human Services, with the individuals that we're caring for and speaking to on a day in, day out basis. Using GIS, we're on a journey to achieve our bold goal to eliminate health inequities, to power better health through location. And it's said that a journey of 1,000 miles starts with a single step, and we are on the way. And my invitation to all of you is, won't you join us for this? And we're on such an exciting trajectory here in the Southeast. As we're addressing the specific disparities, I see an opportunity for us to address the gap that exists between the haves and the have-nots. When I look outside my window here, I see the beautiful Charlotte skyline, one of the fastest growing cities in North America, the second largest financial hub in the country. But also at the same time, Charlotte ranks number 50 as it relates to the top 50 metropolitan cities when it comes to upward mobility. And the disparity, the gaps between the haves and the have-nots could not be more real. And that's what we're talking about here, the power to leverage the science of where to dictate the specifics of how, when, and how much. And like I said, GIS is more than just a tool. It is an enabler of better health and better care. So join us for this journey, and thank you so much for this opportunity to speak with all of you.